Hello and good evening once again, postgraduate research students of the University of Adelaide and JBI collaborators. Welcome to our JBI Postgraduate Research Degrees Webinar Series 2020. My name is Alex Mignoni, Program Coordinator for High Degrees within JBI. It's a pleasure to be here once again and help facilitate our fifth presentation in this webinar series. Thank you again for your attendance. We've got two more presentations for you this evening and next week. Both with an implementation focus. I hope you stay with us for the duration. At the end of the seminar series, there will be a survey. Please do let us know what you think. The feedback that we receive from you will play a part in our planning for next year's program. So as we do at the beginning of every session, we have our acknowledgement. And we're coming to you live from the University of Adelaide. And we acknowledge the Kaurna people as the true custodians of this land that we gather on. We acknowledge the deep feelings of attachment and relationship of the Kaurna people to country, and we respect and value their past, present and ongoing connection to the land and their cultural beliefs. Just some particulars for the session. I'm obliged to tell you that it is being recorded and they're going to be uploaded to the JBI YouTube channel. In fact, I think the first two seminars have already been uploaded to the YouTube channel for JBI, so please take a look. Otherwise, I will be circulating links to all participants at the end of the series. And as usual, all participants are logged in listen-only mode, so we can't hear or see you, but you can interact with us in text. You can either use the chat function, or if you've got a question for our speaker, please use the question and answer function. I'd like to introduce our host for this evening. He's the Postgraduate Coordinator for High Degrees within JBI. He's also JBI's Director of Implementation Science, and he's the Editor-in-Chief of JBI Evidence Implementation. It's a pleasure to introduce Associate Professor Craig Lockwood.
Well, good evening, everybody. It's great to be with you. I'd like to add my welcome to Alex's, which he's already so generously given. And as Alex mentioned, we're approaching the wrap up of this small series. And tonight, though, it's my pleasure to introduce a colleague, a long-standing friend and a really respected member of the global evidence-based community, Kate Kynoch, and she's actually the Centre Director for JBI in Queensland. I won't go too much into her background. She can tell you a little bit about herself, but I like to think of Kate as a pragmatic implementation scientist with a real passion and commitment for improving clinical care in partnership with other clinicians. So I'm as excited about this talk as anyone tonight, and I'm really looking forward to hearing what Kate has to share with us. And I hope you enjoy this as much as I do. I'll be monitoring the questions, so please do put them through, and then I'll facilitate those at the end of this talk. Thanks everybody, and have a good session.
So good evening everyone, and thank you Craig for that lovely introduction, and thank you to everyone who is joining us this evening for this webinar and to hear my presentation tonight. So I was asked by Craig and Alex to talk about implementation with a focus on implementation models and thinking about pre-planning for implementation if you're doing a implementation project or a systematic review or a research project, and how the results of your review or your project might be implemented into clinical practice. And so I wanted the next 20 or 25 minutes to be a little bit of an overview around implementation and the different types of models that can help sort of guide your project through to implementation, focusing on the key aspect around sustainability, because we spend so much time doing this research and doing these types of projects, and we want to make sure that when we actually implement this into practice, we are benefiting patients by improving the quality of care, but also ensuring that what we do is sustainable. Okay, I just wanted to provide a little bit of an overview about my role and my experience in EBP. So as Craig said, I'm the director of one of the JBI centres that is based in Queensland. It's been a JBI centre for over 20 years now, and that centre is actually based at Mater Misericordiae Limited, which is a healthcare organisation in central Brisbane. The campus is located at South Brisbane, right next to the Queensland Children's Hospital. It's a very large organisation with over 7,000 staff, And it comprises both public and private services, including a very large maternity service. And just this year, the organisation has expanded even further. So it already had some small local private hospitals on the outskirts of Brisbane in Redlands and Springfield. But we've expanded even more out into North Queensland, and we've added another 4 hospitals in Townsville, Bundaberg, Mackay and Rockhampton. So not only is this a health service that services a metropolitan area in Brisbane, we also now reach remote communities in regional centres as well as aged care. And our JBI Centre is part of the clinical governance unit within the organisation, which is a statewide unit. And our focus within that unit is working with clinical staff to make sure that we embed research and evidence into practice, so on local projects, but also on a wider scale. So making sure that research is evident and evidence is embedded within policy and systems from a statewide perspective. So that's why I want to focus this presentation today talking about implementation and how important that is to think about that when you're doing your reviews or your research project. So for the next 20 minutes or so, I just want to talk very briefly about implementation science and why it's important. And then I want to touch on some implementation models and frameworks that you can use as a guide to implementation. And then again, talk about the importance of sustainability and why sustaining change is so important. And I want to finish the presentation today with a case study example. So an example from healthcare where we identified an issue within practice. We actually did a systematic review to find out what the evidence is, and we're now doing an implementation study using one of the models that I'm going to briefly talk about today as the framework for that study. So I just kind of want to end on how you can sort of contextualize this and how you can actually use it in practice. So implementation science is the scientific study of methods to promote the systematic uptake of EBP or evidence into routine practice to improve the quality and effectiveness of healthcare and health services. And anyone that works within a healthcare organisation knows how difficult this is to achieve, given the dynamic and changing nature of healthcare. And also given issues such as it takes 17 to 18 years to get actual research evidence into practice. For a variety of reasons, but things like lack of support locally and from leadership, the difference in capability levels between staff, and also a lack of time and resources. So implementation science is a very new and growing field, and there's been lots of implementation studies that have been published. As well as systematic reviews that have been published on methods for implementation and the effectiveness of different implementation strategies. And implementation science uses elements of psychology, behavioural science, change management, as well as sociology to identify techniques that are useful for changing behaviours. And at the core of implementation, it's about getting healthcare staff to change their behaviour and to use new innovations and new interventions. So implementation strategies are methods or techniques that are used to enhance adoption, implementation and sustainability of a practice change. So they really constitute the how-to component of changing healthcare practice. And these are important because by implementing research or evidence into practice, we're wanting to ensure that patients receive the highest quality of care. And we're also wanting to make sure that we're maximising the value for healthcare. And through the literature and in practice, we're hearing more and more about value-based healthcare and patient experience and how that's important. And so it's really important that what we're implementing has an effect on patient outcomes. These strategies are also important because we are selecting strategies to overcome certain barriers that we've identified within our local context. And these barriers are what is embedding, what is enabling us to adopt change. And the different strategies that we use, it's important to be able to evaluate whether they're more or less effective in different settings. So it is really important that we think about how we're going to change practice and what strategies work in different settings. So when we're thinking about implementation, it's really important to plan. And this is something that with any project, systematic review or research that we do, we're always thinking about what this is going to look like in terms of implementation, how it can be used to change systems or processes that we're currently doing. So implementation plans should be well designed. They need to be preferably pilot tested before they're used. Right from the outset in the planning, we need to think about who are the right people and the stakeholders that need to be involved. And where appropriate, we need to be guided by a theory or framework. So before starting or thinking about implementation, you need to be clear about what your aim is and what you're trying to achieve through the innovation. You need to understand the local context where the practice change is going to be implemented. You need to make sure that you're engaging the right people throughout the process. You need to make sure that you develop a clear and a logical plan for the change. And that right from the outset, that you're building support for sustainability. So engaging leaders, engaging staff who are going to be affected by the change. And really making sure that the strategies that you're selecting to change practice can be embedded and sustainable. Now I'm going to touch just briefly on theories and frameworks for implementation. So this, I'm not really going to go into these in any great depth. Being someone who comes from being very involved in healthcare practice and working with clinicians very closely, I know that often staff get very scared off thinking about theories and frameworks and models, but what I want to achieve today is just to get you thinking about the different frameworks and how using a framework can be very practical and can help you in terms of the process and thinking about that endpoint in terms of sustainability. So there's lots of different frameworks out there available to guide implementation. So many of these frameworks will guide the process. Some of the frameworks and models are there to so that you can understand and explain what might influence different outcomes. And some of the frameworks and models also can be used for evaluating the success of the implementation. There's also a number of behavioural change and implementation theories, and I'm not going to touch on these, but things such as the diffusion of innovation theory or theory of planned behaviour and many more different theories as well. So why would you use a framework for your implementation? Well, using a framework increases the project's chance of success and sustainability in the long term. And understanding the framework or model and how you can apply this to the process of implementation will help you choose the right methods for changing practice that actually work and that are suitable for your particular local context. But you need to make sure that the framework or model that you choose is right for your particular context or situation. So I'm now going to touch on a couple of different models and frameworks and just provide a little bit of an overview. One well-known framework is the IPARIS framework. So this is the Promoting Action on Research Implementation in Health Service framework. So this framework states that the likelihood of successful evidence implementation is dependent on 3 factors. The first one being the strength of the evidence. The second being the context of the implementation. And the third area of success being the effectiveness of the facilitation provided by the project team. So in short, if you have high, good quality evidence and you have a context that is open to change and good facilitation, you're more likely to have success with your evidence implementation and long-term sustainability. I'm now going to touch on just a couple of different process models for changing practice. So these models explain and direct the implementation process. So within these process models are action models, which provide careful guidance on the steps that need to be undertaken during the implementation. So they prescribe the specific steps to be followed and outline detailed instructions on implementation. So the first one's the Ottawa model of research use. And I'm going to touch on this a little bit further when I talk about the case study at the end, because this is the model that we're actually using for our implementation study at the moment. So under this model, there's 6 elements. So the evidence-based innovation, the potential adopters, the practice environment, the implementation strategies that you've selected to change practice, the adoption or the uptake by potential adopters, and then the outcomes. And all of these elements are underpinned by continual assessment, monitoring, and evaluation of each of these stages. So I will talk about this model at the end, about how we're actually using this model in practice. Another implementation model that you might be familiar with is the PDSA cycle. So again, within our healthcare environment and our healthcare organisation, we use this model a lot with staff during improvement projects and implementation. So this is the planning. So the planning for your project, so making sure that you're identifying the stakeholders, the who, what, when and where. Do is when you're carrying out the plan. The study element is when you're collecting and analysing the data, and then the final stage, which is acting on the changes and considering what you need to do within the next cycle. The knowledge to action cycle might be another model that you're familiar with in terms of implementation. So again, this is a process framework which outlines the action cycles from identifying the problem through to adapting knowledge to your local context, assessing barriers to knowledge use, selecting, tailoring, and implementing your interventions or your strategies for changing practice, monitoring the use, and then evaluating outcomes and sustaining those changes. And the final model I wanted to just touch on in this presentation is the JBI model for evidence-based healthcare. So again, the model is about taking those issues that are identified in practice through from evidence generation, through to evidence synthesis, evidence transfer, and evidence implementation. And all of this being underpinned by those overarching principles of culture, capacity, communication, and collaboration, and how that these are essential elements that you need to address to ensure successful implementation and sustainability of change. So I know that was just a very brief overview of the different models, but I think the benefits of using a model to guide your implementation, or when you're thinking about how the results of your review or your project might be implemented into practice, I think these models can be very useful because they outline and they promote the need for a systematic approach to the evidence-based change that you're looking to implement. And they all address sustainability of evidence-based practice through a number of key elements, such as organisational culture change, stakeholder engagement, making sure that you're identifying the barriers that are specific to your local context, evaluating the impact of change, and making sure that you're disseminating those outcomes. So for the last few slides of this presentation, I just want to focus on sustaining clinical practice change and how that can be done. I mentioned before in our organisation that we make sure that we embed evidence at a systems level and at a policy level. So that's one of the key areas where you can ensure sustainability from change. Another area is about making sure that any barriers that you've identified don't re-emerge. And by this, we mean things like if you've chosen strategies such as educating staff because of a lack of knowledge, making sure that you're embedding that education long-term into education plans or into regular education sessions. Providing reminders for practice change, I think, is something that seems really simple, but is a really key strategy for ensuring sustainability. So whether this be visual reminders through posters or electronic prompts. But I think sometimes we underestimate how important it is to provide those regular reminders for staff, particularly in healthcare where changes are constant and that changes come regularly every day for staff, and that staff are busy. And I think simple things such as reminders and embedding these changes really make an impact. And I think another really important area around sustainability, particularly in the healthcare context, is around being a change leader and how that when we do make these changes, that once we walk away, things can go back to how things were done before. And so we really need to make sure that there are change leaders that are driving the change. And this comes back to things like the stakeholders that you've involved, how you've embedded those changes, and what your role is in the practice change as well. So in terms of sustainability, change needs to be adopted and it needs to be embedded within the work culture. I think that's really important. It needs to be independent of your personal presence or driving influence. And it needs to become this is how we do things now. So they're all the things I think that are really key to think about in your planning process around your implementation. And in terms of dissemination, staff and stakeholders need to know how it all went, even if everything didn't go to plan. So even if it wasn't as successful as you hoped the implementation would be. So, you know, part of your planning needs to be thinking about how you will disseminate the results of your implementation. Is it going to be through emails or presentations to staff? What other options are there for providing that dissemination? Is it changes to policy documents or systems or processes? Can things be presented at conferences or through seminars? So I think it's through this dissemination is that where we share and learn from a lot of different areas in terms of what works and what doesn't work. And I just want to spend the last few minutes of this presentation just providing a short overview of our study that we're currently doing, which is using the Ottawa model for research use. To just really sort of put some of these things into context for you on how they might actually look in healthcare. So we, through our unit, identified that there was a problem within the ED department where there's a little bit sort of ad hoc approach to using nurse-initiated interventions. So this became a basis for a systematic review that we did. We're looking at the effectiveness of nurse-initiated interventions for managing patient outcomes in the emergency department. And it was from the results of that systematic review that we decided to do this implementation study. And we chose to use the Ottawa model of research use as the framework for this study. So we're actually, through this study, looking at the implementation of a nurse-initiated interventions for pain management in the ED. So I've just used the framework, the Otter model framework there, just to kind of show you how we've adapted that study. So our evidence-based innovation is evidence-based pain intervention utilising nurse-initiated interventions. Our potential adopters within that setting are the ED clinicians. And our practice environment is the emergency department and patients presenting with acute pain. So in terms of our implementation strategies, so we're going to be doing a number of different strategies. So we're going to be looking at the barriers to using nurse-initiated interventions. We're going to be working and doing some focus groups with staff to help identify those barriers, and then also to help us identify the right implementation strategies, both passive and active strategies, to change practice within this environment. And then we're going to do some follow-up strategies, which includes auditing to make sure that we can determine whether the strategies for changing practice have been successful or not. Our adoption is the implementation of these interventions by the clinicians. And the outcomes that we're looking at, we're collecting a number of different outcomes. So we're collecting implementation outcomes. So the number of staff who uptake the intervention, the number of staff who attend the education sessions, but we're also collecting a number of patient outcomes. So we're also doing an interrupted time series study as part of this. And we're looking at a number of patient outcomes such as time to analgesia and pain levels of patients. So that's just to kind of give you a little bit of an overview, and I think I'm already over time, of how we actually went from a systematic review, identified an area of practice where it was very ad hoc, it was not in line with evidence, and how we're using a model to actually guide our implementation and to ensure that we have success with sustainability. And that's just some references. And I'm going to leave it there. So thank you very much. And I know that was a very short 25-minute overview around implementation, but I hope that was helpful and gave you some thoughts for planning in terms of the reviews and research that you might be doing.
Kate, thanks so much. That's really great to hear. Not surprisingly, there's quite a number of questions that come out in a talk like this because you've provided some theoretical framing, you've touched on the conceptual background in terms of the types of evidence, and then you've talked through the application of a framework-based process for a clinically embedded inquiry. But I just wanted to do a warm-up question first. So one of those was, systematic reviews or single studies, what is the best basis for evidence when you're trying to convince a clinical site to do implementation with you?
Yeah, no, that's a great question, Craig. And, you know, being a evidence in practice unit, we do always advocate for, if there is evidence from a systematic review or for evidence-based guidelines, we would be, you know, using that because we're going to have more success with bringing people on board in terms of the change. Obviously, there's not evidence for every question or every policy that we write, so we do really need to think about that hierarchy of evidence. But we would always start with looking at for systematic reviews or evidence-based guidelines to guide that.
Yep. There's a couple of other questions around context here as well. Was there something distinctive about the context at the Mater Hospital that was important in your case study?
for our ED in particular, so for all of our systematic reviews that we do as part of our unit, they're all of the areas for those reviews are derived from clinical problems that we've identified. So for this particular case study that I was talking about, one of the issues was around, yes, that nurse-initiated interventions were delivered ad hoc within the emergency department. And we knew from our investigation of the literature that there was evidence that nurse-initiated interventions can be effective for a number of patient outcomes, including for time to analgesia, so making sure that patients who present get medication sooner and not have to wait for a doctor. So yes, that particular topic was derived from something specific in our area.
Terrific. Look, I think this is a really hard question now, but we're warmed up, right? So out of the models and frameworks you presented, which do you think is the easiest or most appropriate to use in your kind of clinical context?
Yeah, I think that's really challenging question to answer, because I know, I provided just a very snapshot of a number of different ones. The ones I have provided a snapshot are ones that we have used within our context. So we, as I said, we do use the PDSA. That's something that, a lot of clinicians find quite easy to use. We have in our implementation workshops that we deliver to staff, we do present the IPARIS framework, because we think that it's really important to highlight to clinicians that you need to have good quality evidence, as well as a context that is going to be open to change, as well as good facilitation to be successful. So we have used that one as well. So, and I think, there's many more out there, but I think it's more around what you feel comfortable with using.
I agree. I think Trish Greenhow said all models are based on suppositions. Some are useful.
Yeah.
So if you find it useful, I think, which is what you're saying.
Yeah, absolutely.
Yeah. Right. This is a question from one of our master's students, but I wouldn't give him high grades for the question structure. What are the critical factors at an organizational level that differentiate or that identify and facilitate change?
Leadership support, I think, is a huge one. And we've done many projects over the years, from small local change projects to bigger organizational changes, and leadership support, I think, is really key to the success of any project, along with having appropriate resources and time and all of those things. But bringing in the right stakeholders right at the start of the project, I think is key.
Yeah. Look, I know we're nearly out of time, but there was another useful question here. Could you speak to the financial and resourcing costs of the implementation in this particular pain relief model of care? Is that a key driver or factor in the planning for this implementation project, or were there other key drivers?
I don't think for this particular project that cost was a huge driver. This is actually part of one of my PhD students' projects that they're doing. But as I briefly mentioned before, where there is this, more and more focus on value-based healthcare, and how are we ensuring value, and how can we do more for less, and all of those things. And I think in terms of the case study that I have presented tonight, one of the key drivers in that is that we're not just collecting implementation outcomes and being able to show, yes, we've changed practice, but we're collecting patient data. And if we can show that patients, through our interrupted time series study, that patients are getting analgesia quicker and being treated quicker and, flowing through the ED much quicker, then that's going to be a saving for the organisation, and that's going to be viewed very highly.
Yeah, terrific. Thank you. Look, I think we're out of time for further questions, but I want to thank you, and I'll hand back to Alex.
Thanks, Craig.
Thank you, Craig. And thank you, Kate. Thank you for your time this evening and a wonderful presentation. I'm glad that we've got that recorded for future reference. Next week, for our final presentation in this series, we welcome another international speaker. Michael Sykes is a research fellow, and he comes to us from Newcastle University in the UK. He'll be talking about evidence-informed implementation, and to host that evening will be Associate Professor Eduardo Aramataris. So that's it from us once again. I'm pleased you could join us. Thank you for your attendance. Please join us for the last seminar next week. And until then, all the best.